I noticed they left auditing and insurance for the last two subjects of the day. I'm not sure if Seth likes us or doesn't like us, but no, in all seriousness, I thank you for the invitation. It's a great pleasure to be part of this meeting. I'm a member of Potomac Conference, so to come to Columbia Union is a pleasure for a lot of reasons. It's my union, it's my conference, and I didn't have to get on an airplane this morning, and I get to go back and sleep in my bed this evening. So all of those things make this a very exciting meeting for me. I was sitting there at the table and I saw the visitor, and this is what goes on in our union. And there's things in here from building churches to youth activities to prayer warriors, and all of those things are going on. And I thought, and I know insurance gets a bad rap, but the reality is our ministry is to protect your ministry is our tagline. And we spend every day worrying about how can we make sure your organizations can do all of the things you want to do, and not worry about, oh my goodness, we got sued for $14 million, and that's going to bankrupt our conference. Nope, we can go to Adventist Risk Management, and hopefully they can bail us out and get us back on the whole path. So that's kind of what we do for the church. And we take it seriously. I read all the union papers and all the things that come through, and I'm always amazed at what the church is involved in. I'm oftentimes scared of what the church is involved in. But the reality is, this is the ministry we do. This is the ministry as a church that we need to do. And as part of that, insurance is important. So today I want to briefly talk about one hot topic that we've been addressing that I know you as treasurers will need to address. We'll go quickly through the North American Division working policy changes as it relates to insurance and risk management. And then I'll do my best to leave a lot of time for Carlos and all the healthcare changes. I know that's probably what's most on your mind, but hopefully you have a lot of that already implemented. Real quickly, I want to introduce my colleagues who are also with me. Most of you know Herta Martinez, sitting here. Wave your hand, stand up. She's your account exec for 99% of the union here. Just behind her is Eliel. He is the account exec for Potomac Conference. Yes, Potomac Conference needs one person just because of members like me. You know, they're a risky conference. But, and then I always travel with my CFO. It's payday this week, so I got to make sure he's happy. Jermaine Jackson is our CFO. So just want to introduce those and let you know that we're all here representing Adventist Risk Management. One of the important topics that keeps coming up is our churches are going out and shopping for insurance outside of the conference insurance plan. And I understand that you sit in a chair where these are your constituents, these are the people that vote you in, and when they go out and they find insurance that they believe is less expensive than Adventist Risk Management or any other insurance company, I know that puts you in a position where you need to defend your decision as a conference administrator of why we have an insurance program for the entire conference. So I want to address some of the things today as it relates to that. We'll talk about changes to the updates and then ARM resources and et cetera, et cetera. We want to move through this quickly. We thought we had 4 hours, but Seth only gave us an hour, you know. When it gets to insurance programs, think about your conference. We heard the auditor say assets aren't showing up at the conference statement or the statement. Or they're not even showing up on the academy or the schools. The reality is I heard someone this morning say the properties are in trust at the conference level. And this is a very hard conversation for us to have as members of the Seventh-day Adventist Church, because I'm a member of Beltsville Seventh-day Adventist Church. I help build the church. It's my church. For Okeemus to walk in and say that's Potomac Conference's church would be offensive to me as a member, and I realize that. But the reality is the land, the building, and the activities that happen to that church are Potomac Conference, and it goes through each one of us. So we are one organization that owns and controls all of the schools, churches, and we at the conference level will be held liable for their actions. So when they go out and look for a church, or if they go out and look out for insurance, who has an insurable interest in that building and its activities? That's the first question that always comes to my mind. If XYZ Church goes out and gets an insurance policy in XYZ Church's name, have they actually bought any insurance? Now, I can argue both sides, but the reality is the answer is probably no when the claim comes through. And we have seen this happen where the other insurance company says, hold up, when the lawsuit comes through and they sued XYZ Church, That doesn't even exist as an organization. It's not a corporation. It's not an association. There's nothing to sue there. So we don't have to respond on our policy. So that's the first thing that comes to my mind from an insurance standpoint. Move on here. Sorry, I left my notes at home. You've heard North American Division working policy. Is the conference the first named insured with the following organizations as an additional insured, the union, the division, and the GC on this policy? So if you as a conference administrator say, you know what, local church, I'm willing to make the decision that you can go out and get a local policy on your own. Have you reviewed the policy to make sure it at least has that language on there that protects you as the conference? The North American Division, the union, because in the end, they're going to sue your conference. They may start out by suing the local church, but in the end, your conference will be named in the lawsuit, and if you don't, or if you're not named on that policy, you will not have protection under that policy. Are the liability limits within North American Division's requirements? When it comes to liability, if they go out and buy on their own policy, they need $3 million per occurrence or per claim, and $10 million per an annual or per a year policy. So start thinking about that when you start asking these questions of a local church. Have you really shopped apples to apples insurance? Does it meet the needs of our conference, not just your local church? Is it what we really need as an organization? And if not, there's a potential for a gap. The church has a huge excess program that goes from $3 million or $3,000,001 all the way up to $100 million. And if a local church has not put together, or your conference hasn't put together the primary policies to get to that $3 million, you're uninsured. So what happens if a claim comes through at a local church or your conference has only purchased $2 million of coverage and the claim is $10 million? At minimum, you're insuring between $2 and $3 million on your own. So can your conference afford a gap in coverage of $1 million? And we've seen this happen. It's not just an advertisement for Adventist Risk Management. It's an advertisement for the Seventh-day Adventist Church of, we want to work together with you, whether you're with Adventist Risk Management or any other carrier, to make sure the suite of coverages comes all the way up to the top. I can assure you, we've seen some very large claims in the last 2 years. I've been with Risk Management now for about 12, 13 years, get longer than I hate to admit, but we've had our 2 largest losses in 2012 and 2013. It's not getting better out there. People are suing everybody for everything, and the courts are awarding very large claims. I've heard a lot of questions from the standpoint of, well, if we only bought $5 million, that's all we'd ever get sued for. It's not true, trust me. They'll come in, they'll request the financial statements of the Chesapeake Conference, the Potomac Conference, whatever, and they'll find out what your assets are really worth, and they're more than willing to go after all of those. Premium allocation. We do our best to work with you to provide you different ways to allocate the premium down to your local churches and schools. The one that I think is the best is what we call the ISO. It's Insurance Services Offices. It is based out of our rating system. It is fundamentally what insurance is. It will take on the location of that church, the size of that church, how that church is made, what it is used for, and it is the best allocation. If you ask me what allocation methodology do you need to be working toward, it's that one. It is the one that will hold up to competition the best. But I understand. You're in a conference and there was a church that was 10,000 square feet. It had 800 members, and the local school closed down or the local business closed down, and that church is now down to 50 members. And the reality is, when you look at that building on its own, the insurance is very high, so you as a treasurer make a decision, I'm only going to allocate a little bit to that small church, and I'm going to allocate more insurance to my more healthy church at this point. I can't stop you from doing that, but think about when the big church now, who's getting charged probably at 150% of what their actual insurance is, when a local State Farm or a local Guide 1 insurance person's on their board and says, we're overpaying for insurance. It appears that way because we've allocated a lot more to them than what they should be paying. I understand it's not just simple things like that, but you got to work with transparency and talk about what you're doing. I think it's totally fair to allocate property insurance. It's their building, it's the building, it's easy to allocate that. General liability, that covers the activities at that local church. I think it's fair to allocate down the primary general liability policy. Employment practices and sexual molestation, I think the employment activities happen at the local conference. Yes, the potential for sexual molestation happens at the local church, but be careful when you allocate that one out a little bit more. That might, in my opinion, be more at a conference level. The excess liability, I do not think that should be allocated down to a local church. That is a policy at that level. We're talking millions of dollars of limits. It is designed to protect your conference. We can debate that all day. It's one-man opinions, but when you start allocating the hundreds of millions of dollars of limits down to that local church, if you do it, be very upfront with what you're allocating, because they'll go out to the local agency and think that they're getting charged for just the first million, and it's, you know, $1,200, $1,300, and they don't understand that it's not apples to apples. So be very transparent of what policies you're pushing down. The other thing we've run into is there are conferences that charge processing and administrative fees on top of our insurance bill. I don't have a problem with that, but please disclose that to your church, because then we get put in a position where the cost of insurance is inflated because they're not aware there's an extra 10 or 15% fee on top of that. You know, I understand it costs, you know, it takes time and money to process for you, but make sure your conference or your churches are aware of those things. Any questions on that subject in that area? I've talked through it very quickly, but we've talked to your presidents on this subject at President Symposium. We realize this is not a black and white issue. There's a lot of decisions you're going to have to make as treasurers, but we want to help you understand that a conference-wide insurance program really is the best success. Real quickly, we'll go through these. Changes to working policy. The FD 20 provides some clear wording on you have the right to review the agreement with the sexual offender meeting in your church, and if they're not meeting, if they're not holding up their end to the agreement, you can ask them not to worship at your church. Increase the recommended limit of liability insurance requirements to $3 million. That used to be $1 million with a minimum of $1 million. So if you're renting your church or your school out to somebody else to use the building, depending on how large and what the contract is, start to push for $3 million on those certificates of liability insurance. You shouldn't get a lot of kickback on that. We get asked for hundreds of them for when we go use other people's locations, and $3 million is the new million. It's just the world we live in. We're seeing higher and higher lawsuits. Errors and omissions liability. If you're contracting with an attorney or you've retained an attorney, they've increased that to $3 million instead of $1 million. Once again, just reflecting the world in which we live in. The North America Division went out and queried a few law type organizations and asked what is the level of insurance on E&O that you normally have, and $3 million was very obtainable for almost every attorney, and that's what they carry nowadays. So as you retain attorneys or attorneys you already have retained, as you renew those contracts, ask for some new certificates. Driver record qualifications was changed to result in a conviction of a misdemeanor. This used to be just a no-fault accident, and so if someone had been involved in a no-fault accident, they could no longer drive on behalf of the church. And when you think about that, if you just backed your car into a stop sign, that's a no-fault accident, and you were no longer qualified to drive on behalf of the church. So when someone actually read it, they said, we'll make it a conviction of a misdemeanor or criminal charges, and that would change that. So clarification. Equipment breakdown and cyber liability insurance are now recommended to be part of your conference-wide policy or insurance program. Equipment breakdown is very easy for us. We'll include a quote on that with your property insurance. It works seamlessly. And then cyber liability insurance. If you haven't already started working with HERTA and LEL, we'll provide the certificates of insurance, and more than willing to do that. I heard there was a question this morning on cyber liability along the lines of, is email, if email was hacked, would it be covered under this policy? I'm not an attorney, but I'll give you an attorney answer in some way. It depends. It's hard. It's hard to say yes or no. It depends what was involved in the hack. If the hack caused damage to a downstream third-party organization, it probably would be covered under this policy. If it involved, damage to your organization that stopped you from being able to do business, it might, depending on the coverage you had purchased. The gentleman who I was talking to says, hopefully you're not passing bank account numbers and those things through your email system, so you've greatly reduced the risk of email liability. But as you work through that, if that's something you want clarification on your quote, we can by all means get that through the carrier. Real quick on healthcare, this is to just meet some requirements for the Affordable Health Care Act. We're all one program. And an editorial thing there I mentioned earlier, there's 100 million in limits, so from 3 million plus 97 million, we get to the 100 million. Contracted services, again, increasing it from 1 million to 3 million for large ones, and a million is a minimum, excuse me. And then for independent contractors, a recommended limit of 3 million for major construction projects and 500,000 for minor construction projects. Real quickly on this is an area where we're seeing losses. It's not only the liability insurance you need to be verifying, it is the workers' compensation. We've paid some very, very large claims where if the contractor had workers' compensation, the church would not have paid the claim. And when I say large, 1.6 million, 1.8 million. That's not minor money. That's major money, and it all would have been prevented is if part of the contract we had made sure these people had workers' compensation. So we're seeing a real trend in local churches entering into contracts without attorney review and without conference approval. And like I said, I'm not an attorney, and I have to run every contract by my attorney, and I'm always amazed. Like, I read it first and I think, yeah, this is a good contract. I'm in a good position here. Guaranteed the attorney comes back and finds something that we could do better on behalf of our organization or something I missed. So let's not play attorneys, and let's preach to our churches and our schools that if you're going to enter into a contract, please have the conference attorneys review it and make sure it meets the needs to protect the organization. Real quickly, we've updated our website. We're very proud of this. In the last quarter of this year, new content, better refined content, and a lot of stuff in Spanish. So send your churches to our website. We think there's a lot of resources, and hopefully each one of you are implementing the safety officer program. And if you're not, we're more than willing to work with on you that, because the activities happen at the local church. If we can prevent losses at that level, that's where we save the money for our organization. And it's more than money. It's our reputation in the community. It's always amazing. You can set up these Google alerts where if the word Adventist or Seventh Day or whatever, it'll send you that news story. And it is amazing how you see the church being represented in the news and in the communities. And if our good reputation is ruined, no amount of money will bring that back. Now on to healthcare. Carlos, it's all you.
All right, most of you probably aren't very familiar with me, but I work closely with all your benefit coordinators and human resources departments. Let's just go ahead and start. I have quite a bit of information to give out. I'm sure most of you have either already read this information or been exposed to it at some point by Ellen Eldridge. But let's just go ahead and start a brief overview. We're going to be touching base on the Affordable Health Care Act. We're going to review some of those financial trends, as well as transitions that are upcoming for the year 2015. Okay, these are all review. Basically, the no aggregate lifetime limits on essential health benefits. It used to be limited, I believe, around 3 million, but I think it was 2011 is changed to unlimited. Children are eligible under an employee until the age of 26. Up until 2011, there was some restriction based on their employment or marital status. That is no longer there, so they can be under the employee up until 26, no questions asked. As well, in I believe it was 2012, 2013, we did away with the pre-existing conditions clause. That was actually mandated federally in 2014, January. Our preventative care is paid at 100%. So if you go into the doctor for preventive services, that will be covered at 100%, including a copay. So even if you're paying a copay, you shouldn't be. Your doctor needs to be advised of that. There's also the defined categories of essential health benefits that are outlined in the Healthcare Act. And you need to keep in mind that full-time, as far as consideration for healthcare benefits, is 30 hours now. It's not 40, it's 30. And that's a very thin margin, especially when you get with part-time employees. Okay. These are two fees or taxes that are coming about because of the Affordable Health Care Act. The first one is the patient-centered outcomes fee. This is assessed based on the employees, and this is over 12 months. This is based off 12 months. As you can see, it's slowly increasing little by little. The next is the transitional reinsurance program fee, and that is actually over a 10-month period. So essentially, we pay for you guys and you pay us back, and it's all going to the government. This may be probably one of our more scary up-and-coming fees or taxes that we're actively trying to work around and make sure we can prepare for, as far as making sure our members have coverage that's quality and is maintainable by all of us. This does not take place until 2018, but it's essentially it's a 40%, that's right, 40% tax on any healthcare plans that have a payable value of over $10,200 for an individual or $27,500 for a family. That's on anything that you pay, not the premiums, it's claims. So the employees' co-payments are not in there. Deductible is not in there. And it's essentially all the stuff that is self-funded by you, the employer. The ways we're trying to get around this tax and maintain under those taxable levels is we're making adjustments in member responsibility. This year we're changing to a two-plan setup in some groups. I don't know exactly which groups have chosen to elect a legacy and a standard plan, but essentially that's one of the ways we're trying to do this. In the future, possibly 2016, we're looking at carving out dental and vision out of the bundle to make it a little bit cheaper for some of our smaller employers. And we're also looking at lowering in further benefit options for employees. Now, because of all these changes in place, according how all the trends are showing in the stats for healthcare costs, we shouldn't be getting near these thresholds until around 2023, which I know it sounds like it's a long time away. However, things can change quite rapidly. I mean, it wasn't less than a decade ago we didn't have affordable health care. Okay. I'm not going to comment on that. These are just some trends of essentially where the majority of the costs are going for just medical right now. The first, and this is for 2013, 2012, 2011, and 10. The highest category is symptoms, signs, and ill-defined. Basically, anytime someone goes into the doctor not knowing particularly what is ailing them, and they're just trying to get answers. Muscular, skeletal, and connective tissues, that's either broken legs, arms, any kinds of ligament injuries, that's where that would fall. And neoplasms, which is essentially cancer type claims. Cancer is usually, or neoplasm claims are usually in the top 3. And for the most part, there are a very small number of claims. However, they tend to be very high dollars, and that's what pushes it up that high. here's a breakdown of where the other lines of coverage come through and benefits. Essentially, that 67% of all the medical costs, that represents around $70 million across the board for the entire plan. Okay, this is just a small breakdown of essentially how much cost is allocated per employee per year, and then per member per year for an additional dependent spouse or child. As you can see, it's slowly increasing, and this is going to be continuing. This is just how the industry is going. It has nothing to do with our members specifically. It's just healthcare is starting to cost a lot more every year. And one of the ways that we're trying to protect all our employers is through our stop loss program. Now, unfortunately, this year we're having to increase to cover some more of those volatile costs that are continuing to increase across the industry. I'm sure each group has different sizes for the amount of risk that they can feasibly undertake, but these are the new deductibles for this upcoming year, and we've actually added a new deductible range of the $250,000. And then you see a breakdown there of how much premium there is, and that is per employee and per individual. And I'll tell you what, if you just get one person that has a really bad cancer situation, it can easily get into the 250 and above range within a year. It's that important that you have all your members insured as well as you can possibly, because I'm pretty sure most of you cannot afford to have all this risk paid up front. Okay. For this upcoming plan year, like I said earlier, there is a new addition, as we call the standard plan. The legacy plan is essentially the same plan we have currently, and it's going to be continuing. There's not going to be any changes to that. The standard plan has a few minor changes, and depending on what your organization has already opted, your members may or may not have a choice between them. Okay, the major differences between standard and legacy are going to be variance in member responsibility. Members are going to experience a little bit higher deductibles as well as out-of-pocket costs. The plan benefit for dental and vision is going to be a little lower than it would be under the legacy plan, and a not so popular portion of it, massage therapy and acupuncture, is not included in the standard plan. Okay, because we have a two-plan situation, we can't have continual open enrollment throughout the year. It's completely different now. We essentially have 3 reasons that a member would be getting into the plan. You have through initial enrollment, either a new hire or someone that has become newly eligible. You have special enrollments that are due to a qualifying life-changing event. For instance, a loss of a spouse's coverage, or someone who has opted out of the plan previously, and that coverage they had has become non-existent anymore. That would be one of those qualifying events. And open enrollment, in which members can make any kind of changes during that open enrollment period before the new plan year. I've kind of already talked about this a little bit, but keep in mind that if you do have some sort of an elimination period for your members, this cannot exceed 90 days. And that 90 days is an exact 90 days. It can't be arbitrary. Started on August 1, first day in November. It can't be that way. It has to be exactly 90 days. Okay, for the special enrollments, you have 30 days after a life-changing event in order to submit any changes to the plan. Some of those qualifying life-changing events, and these are per the IRS guidelines, are marriage, divorce, birth of a child, adoption of a child, or loss of another coverage. employees can add or remove dependents from or to the coverage at any point. This may well result in changes in coverage tiers. That may affect how much you pay in premiums, so keep that in mind. And this is very important that employees, once they've selected a plan, whether it be legacy or standard, they can't make a change in that throughout the year. They have to wait until the next plan year in order to opt to switch to another one. Okay. When we decided to make a change from Blue Cross or any vendor, we always have to ask a few questions as to whether or not this is good for us and for you, the employers and our members. Essentially, it has to follow this criteria. It has to service the employees in that it would be as good or they would have better coverage by this change. It has to service our clients let me just go to the next one. Financial implications would realize savings for the church. So essentially, if there's no benefit to you financially and it does not follow the other criteria, we shouldn't even be considering that. However, in this PPO change, all those criteria were met. We did a study based on the coverage that we had in the PPO network under Blue Cross versus our new PPO network under Aetna to see how many of those providers crossed over in the general vicinity where our members live in. And we saw that 96.9% of the doctors that were under the Blue Cross PPO network were also in the Aetna PPO network. And that essentially put it around 2 doctors for every member within 10 miles, which is especially good in some of these more remote areas. Our area is not as big a concern because we're in more metropolitan areas, but some places in the Midwest and North Pacific, it may be a little more difficult. As far as and the providers also will be in that same area. The numbers are very similar. You're not going to be losing a lot of doctors. Chances are most of the doctors that you already go to are going to be in the Aetna network, as well as the discounting is almost going to be equal. So there is not going to be a whole change in the amount of providers as well as the cost that is going to be associated with this change. You should be receiving more of a benefit. This comes down to administrative fees. This is something you guys all watch very carefully every month. Just a small breakdown, but essentially because of this change, we're going to be having a $17.09 approximately savings in administrative fees, 2 of which we will be funneling into a pool that is going to be reserved for the Wellness Reserve Fund. The wellness program we had under Blue Cross Healthy Lifestyles is going to be obviously gone because Blue is not going to be there. However, we're working towards designing and preparing a new wellness program for you all, and those $2 are going to be put into that fund to prepare for that program. Okay, this is just a little bit of the administrative impact that's going to come forth. There's really not going to be a lot of changes about the process. However, there are some very good things. There's no deposit required. As you know, Blue Cross required quite a few funds to be allocated on deposit for paying claims. There's no fronting of stop-loss claims, which any of you that have had to deal with a very high level of cost for a stop-loss claim knows that's very difficult to deal with. So that will not be there. Aetna, HealthScopes will be fronting that while they clear those stop-loss claims. And this overall is going to create a reduction of administrative costs. And this is going to affect you more as a member, but essentially we're going from 2 cards to 1 card. There's not going to be any more confusion as to which card you present at the doctor's office. Trust me, there's a lot of questions that come with that, and a lot of the claims issues we find are based just because the wrong card was presented. So that should cut down quite a bit. we're going to be coming down to 2 member portals rather than the 4 that we had for all our vendors, and 2 member service phone lines rather than the 3 we currently have. This is just a small sampling of what it could look like. It's not 100% down pack, but more than likely it'll look like this. This is just a little brief overview of the plan partners we currently have. PBM is a prescription benefits manager. That's what the industry calls any company or vendor that's managing your prescriptions. And in 2015, we're shrinking it down to this group. It's simplifying things quite a bit. Essentially, HealthScope will be your source for customer service for major medical, dental, and vision. Express Scripts will continue to be your prescription benefits manager, and we will be utilizing Aetna's PPO access for major medical as well as dental instead of Concordia. Okay, because of these changes, and as I alluded earlier, we will be doing an open enrollment every year. And in this open enrollment period, while this year was a little tighter, it was kind of a last-minute switch, and I'm sure everyone felt the squeeze. But normally, we'd have a 3-month window prior to the beginning of the new plan year in order to make these changes. So that's something that we should be looking forward to in the next year. We'll have a little more extra time to make decisions and better plan for the next year. Okay, and if you do offer a choice, you should have an open enrollment period. You have to, actually. However, if there is no choice, then your members don't need to fill out any extra paperwork. They just go ahead as they have been doing. So it makes it a little simpler. But again, if you do have that choice, it gives your members a little flexibility as to how they handle their healthcare costs. Okay, here are some of the timelines. Some of these are well underway, and this is for open enrollment for this new plan year in 2015. It's going to be effective on the 1st of January. We're working to get these cards already in the mail as of December 29. This week is the deadline for all the open enrollment forms to be sent into our office. We should have them this week. And most of you have probably already wrapped up your open enrollment at your office, but in case you haven't, it's time to start wrapping that up because there is quite a lot of work to still be done. Okay, this is for your provider network. This is the website you should be using. It's just www.aetna.com/ASA, and this is specific to our plan, so it's a very important link. This will be available on our website, and you can always call in and get more information about that. As well as that, we'll have various materials for the new plan year. It'll all be available on our website. The link is right there. But if you do have questions, our customer service line for just you guys, just for you as benefit coordinators, treasurers, and associate treasurers, it's the 301-680-6868. This is the same number we've had for some time now, but we're still there, and we're available if you have any questions. Okay. Now there's 2 webinars that are currently available on our website. It covers a lot of the questions you may have regarding the changes and how to manage those changes for this year as well as upcoming years. And they have been done by Ellen and David Fournier, and they're available as well on our website under this link. And all of these are under the Health Benefits tab of our website under Healthcare Forms. So they're all bundled together clear that you can find them all in one place. Does anyone have any questions?